So today I'm going to be talking about a study done on titled Profound Depletion of HIV-1 Transcription in Patients Initiating Antiretroviral Therapy during the acute phase of the infection. The study was done by equal collaboration of Adrian Smith and Sarah Gianella, and it was done at the Division of Infectious Diseases and Hospital Epidemiology at the University Hospital of Zurich in Switzerland. So throughout the presentation, I'm going to be covering some background, the purpose of the study, the experiment, the methods they used, the results. We'll go over the analysis and the conclusion. So just a little bit HIV background. In 2008, there were approximately 33.4 million people infected with the disease, and 2 million people died of AIDS-related illnesses. Globally, less than 1 person in 5 at risk of HIV have access to treatment, and 36% of these people who suffer the illness access HIV treatment by the end of 2009. There are also side effects when people get treated for HIV, like liver problems, pancreatitis, diabetes, changes in body fat, and increased bleeding in people with hemophilia. And all these risks increase as the longer you're treated for the disease. So the longer you're on therapy, the more likely you are to get some of these side effects. Now the study is focusing on the effects of combination antiretroviral therapy at an acute phase. And it started in acute phase because there's a lot of virus in the plasma when it's acute, so they want to attack it to prevent the expansion of the latent reservoir. And even though it has been seen that it depletes the virus, it hasn't resulted in the induction of the disease after free period. So as soon as a person stops therapy, the infection just rebounds back up. So the benefits are a little controversial. Is it beneficial to start in the acute phase and then go the risk of having these liver problems or diabetes, or should we just start it in the chronic phase? And I chose this topic because there's so many people with HIV that don't have access. So there was a way, there was no difference starting in the acute phase versus the chronic phase. Then why maybe people should just start in the chronic phase and just prevent those side effects. So just I'm going to go over the viral genome. So the virus is it reversibly transcribes itself into the DNA. It makes the DNA double strand and gets inserted into the host cell. And when it's done, it produces both the messenger RNA and the genome RNA. And this all takes place in the cytosol of the newly infected cells. Now, HIV protease is a viral enzyme that has a major impact it plays a major role in the development of the HIV virus, because the viruses have to break down from a larger protein, and it's the Gag-pull protein. So once this protein is done, this HIV protease will cleave this protein to spit the virus out of the cell. And so they're derived by the Gag-pull protein, and it cleaves the HIV protease cleaves the Gag-pull. HIV protease catalyzes hydrolytic cleavage of several peptide bonds, but more specifically between proline and phenylalanine, and also between tyrosine and proline. Now, protease inhibitors, this is to prevent the cleavage of this protein, and some of them are saquinavir and crixivan. And these are these have been used in part of the combination treatments. The combination treatments are 3 or more drugs, and this is to make it highly effective, and this is just 2 of them that represent part of those protease inhibitors. And they're designed by transition state analog approaches. So the study was to monitor HIV-1 RNA's transcription in patterns in the peripheral blood mononuclear cells during the acute phase of the treatment. And through this, they accessed the effective early treatment of the cellular viral reservoirs. And at the end, they compared it to those that started in the chronic phase to see the difference, if it was beneficial or not. The methods they used, they took 24 acutely infected patients and treated them 3 to 15 weeks after the infection was detected. Plasma viremia was monitored using PCR assays, qPCRs, and the PBMC-associated HIV-1 nucleic acids were quantified by a patient-matched qPCR, and the HIV DNA, vDNA, was assessed as a measure of total infected cells. For the investigation, they quantified the unspliced RNAs and multispliced RNAs, TAT and F, and both of these were found to be expressed in both latently and productively infected cells. And the marker for productively infected cells was the variant RNA. We'll see it as a VREX. So here are the results. This is the baseline when they first got treated. And here we see the viral RNA had an exponential depletion, and then it was almost undetectable. Here, it had an immediate depletion. It was undetectable. But after the treatment was stopped, this had a higher rebound. The nucleic acids had a higher rebound in the plasma, but the VREX had a delay in the rebound. These are mean times that were measured of the time it took for the virus to reach undetectable measures. For VREX, it was 4.5 weeks. For msRNAs, 8.4. For the unspliced, it was 13.5. And for the plasma viremia, 24.6. But all the RNA species remained undetectable at almost all time and point during the treatment. After the treatment was stopped, the rebound for plasma viremia was about 4.2 weeks, the unspliced 8.0, the multispliced 9.8, and the VREX 17.9 weeks. Now we wanted to see the effect of baseline, and then this is during the treatment, and this is when the treatment was stopped. In the viral RNA, we could see a significant change in the copies of infected RNAs produced. The nucleic acids, we can see there's really not a significant change here either. This one did lower though, the multispliced snapped RNA. But here, I mean, this is significant for the viral RNA total being produced. There was a significant decrease. And these were all patients that began treatment during the acute phase of HIV. Now to see the real effects, they had to also test the patients with chronic infection. They started therapy during the chronic phase. 15 patients initiated antiviral therapy during the chronic phase, and they were assessed for the same things, the viral RNA, PBCM, and their treatment lasted 15 weeks. It's a little shorter during the chronic phase. And they used identical conditions for the patient group, including the RNA extraction, the use of patient-matched primers, and PCR input volumes. These are after the treatment was done. So here we have the acute and the chronic of vDNA. So here we see it lower also, the number of copies produced. The unspliced RNA, it's also much lower in the acute. Those who started treatment in the acute, and the viral transcription rate was also lower. We could see a lower change for those who started treatment in the acute versus the chronic. So comparison effect on the, oh, it went up, huh? Sorry. So conclusions, starting therapy during the during the acute phase significantly depleted the number of transcriptionally active proviruses, and productive infected cells expressing VRIX vanished almost instantly after initiation of the treatment. And HIV-1 RNAs expressing cells with longer lifespans almost approached depletion. So findings implied that early treatment of HIV did lead to the clearance of long-lived cells harboring transcriptionally active Latin reservoirs. The Latin reservoir was reduced by initiation of CART during the acute infections. And also, the longer the patient is going through therapy, they do have risk of becoming immune to these drugs, and so drugs have to be continuously be produced. Like in 2008, there was about half a dozen drugs being used in the combination treatment. And there was one hospital in Georgia where they were treating 4,000 patients, and 50% of them became immune to the drugs after, I believe it's 3 months. So it's almost like there are pros and cons in starting the acute, because it's just, I mean, you're not going to defeat the virus, it's just going to spread, but you can control it. But then you also, the longer you go, then the more risk you are of having these side effects. And my references.
Okay, thank you.